So we have a third clinical example for energy treatment of musculoskeletal pain. An elderly man came with shoulder pain along the right small intestine meridian, mainly at the scapula and on point tripal warmer 14. If he sat or lay back on these areas, the pain increased, and he would also feel the pain down to the back of the elbow and to the dorsum of the wrist. He had the feeling that his wrist was swollen and blocked. He could not extend it well. He had had the pain for the past 6 weeks and felt it was gradually worsening and affecting his sleep and relaxation. So this pain pattern is seen in many elderly patients. If it is present in the left shoulder and scapula and could be mistaken for angina pectoris. Yet it is very simple to treat without medication. Diagnosis: damp pain on small intestine and tripal warmer meridians. The patient had mainly pressure pain, worse when patient rested on the area of the pain, which indicated that there was some fluid underneath. He also felt that his wrist was swollen, although there was no visible edema. He could lie on the other shoulder without pain, which meant it was not worse during rest, but only with pressure. The radiation of pain was only present when he put weight on the scapula. So dampness was the cause and nature of the pain, which is a yin-dominant state. And since it was about 6 weeks since he started feeling the pain, it was a subacute state, okay? Which means that a yin excess and deficiency at the same time of the meridian. As the yin was in excess, the yang had to be deficient. Treatment: points tripal warmer 14, SI 11, 10, 9, and 2 Ashi points along the small intestine meridian. SI 7, tripal warmer 5, both Luo points that sedate yin and tonify yang on their meridians. Stomach 40, also the Luo point and symptomatic point to circulate dampness. After the local needles were removed, 4 dry cups were placed at the scapula and tripal warmer 14. Patient was treated 3 times in 1 week. The pain disappeared in the first session, but the treatment was repeated to consolidate the results. We go to the fourth clinical example, still on energy treatment of musculoskeletal pain. We have a male patient, 37 years old, who came with a chronic low back ache of over 6 years duration. He was treated 4 years back and had been free of pain until recently. He had had the pain for more than a year this time. The pain was exactly in the middle on the Du meridian at the level of lumbar 4 to sacrum 2, and he experienced it only in bed about 2 hours after lying down in any position. He was then very uncomfortable in bed and even tried getting up and walking around, which seemed to help. He was also very stiff and had a great deal of pain in the mornings on getting up. He felt better within an hour with movement. He could not put on his socks and shoes in the morning, but had no problem later on in the day. His work required long hours of sitting at his desk and in his car. Diagnosis: Du meridian, damp cold pain. The pain was worse during and after taking rest. There was morning stiffness and limited mobility, which improved as the day went on. Cold pain worsens while resting and improves within a short time of movement that is required for warming up. Damp pain is due to stagnation of fluid. It is worse after long periods of passivity and needs a longer time of movement to improve the circulation of the fluid. Since the patient's pain had both aspects, it was a damp cold pain. As a chronic cold pain, the yang is deficient, as all chronic situations are primarily deficient states. As a damp pain, there is stagnation of body fluid. This means that the fluid in this particular area is more than at the other places. Treatment: warm the cold and circulate the dampness. 6 hot needles, 2 on the 2 meridian and 2 on either sides on the Huatuo points. Extra 21. Cupping after the needling on the same area for 10 minutes. SI3, confluent point of 2 meridian to tonify its yang. Stomach 40 for circulation of body fluid. Do 1, luo connecting point of 2 meridian. Connects it with Ren, the coupled meridian, tonifies yang, sedates yin. Treatment was given twice weekly, but it was not before 8 sessions that the pain showed improvement. The sessions were then reduced to once weekly and continued for another 8 weeks.